Psych and film Fatal Attraction. My character is Alex Forrester. She plays the main protagonist in the movie Fatal Attraction. She's an accessible editor for a publishing company. She meets a married man, Dan Gallagher, through business connections. He has a brief affair with her, and Alex becomes obsessed with him and afraid of his abandonment. Set in New York, filmed during the 1980s, time when the psychiatric diseases were overlooked. She suffers from borderline personality disorder. What is this? Is insecurity and self-mood. In interpersonal relationships, individuals experience chronic emptiness, behaviors impulsive, unpredictable, and sometimes self-damaging. And they do anything to avoid abandonment. The movie was filmed in the 1980s when borderline personality disorder just became official. So therefore, she saw a therapist who would most likely be misdiagnosed because it's so new with emotionally unstable personality disorder. Borderline personality disorder is characterized by unstable impersonal relationships, impulsivity, self-harm, and self-mood. And culture helps develop all of these symptoms. So therefore, as we can see in Western cultures, there has a lower rate of self-poisoning than Eastern cultures because Eastern cultures tend to have higher guilt structure and Western cultures value independence and promote individual tasks. As we can see, like the cultures are different and therefore BPD plays a bigger role in one than the other. So it's commonly mistaken for unpredictable people, BPD, and individuals feel like they're walking around eggshells around people with BPD, and they feel like they cause trauma and pain to their loved ones. These are all misconceptions. Stigmas often affect a practitioner's diagnosis of a patient and makes individuals feel inhumane. Two major symptoms I found she displayed are impulsive and suicidal behavior. Some description: suicidal behavior is characterized by recurrent suicidal gestures or threats or self-mutilating behavior. Impulsive behavior is frantic efforts to avoid real or imagined abandonment. So examples, in the movie, she broke into the guy's house, Dan Gallagher's house, murdered the child's bunny and cooked it. She also broke in and tried to murder the wife and Dan Gallagher, the guy she wanted to see. And then she kidnapped their daughter, and that's very illegal and very impulsive. Next, the suicidal behavior, she ended up punching herself in the head when he wouldn't answer her calls, and she cut her wrists because he wanted to leave their house, and it made him stay, and this was very, very suicidal. So she did not show affective instability. This is almost like bipolar disorder. It's reactivity of mood, intense episodic euphoria. It usually lasts a few hours, more than a couple of days. It's periods of anger, panic, or despair, rarely relieved by periods of well-being. It's as we can see, only 15% of these BPD patients have bipolar disorder. So because it's so less likely, that's probably why they didn't show in the movie, because it's not a common symptom of BPD. So I would treat with mentalization-based therapy and supportive psychotherapy. MBT helps patients manage their emotions by feeling understood. This allows them to be more curious and makes fewer assumptions about the intentions of people around them. So it helps them make less impulsive decisions. So BPD patients struggle with understanding those around them and abandonment issues. This will allow them to comprehend decisions of other individuals without upsetting their mood. And supportive psychotherapy works to improve effective regulations, decrease impulsive behavior, and correct cognitive disorders. It helps to minimize BPD patients' frequency, intensity of self-injuries, and suicidal behavior. So it helps them understand it's a less anxiety-filled type of therapy. So according to new research, the study indicates that both MBP and supportive treatment are highly effective in treating BPD. So some ethical concerns I found were when a patient is trying to go through these two therapies, they often develop mental issues like depression. They get antisocial eating issues like binge eating and addiction to drugs and stuff like that. And it's culture hindering treatment. So religion follows certain paths. It doesn't allow them to feel like themselves. It's hard for them to fit in with their family, and the communication within a workspace is hard for them to connect with others because of their disorder. So these culture norms influence personality problems like emotional dysregulation and impersonal hypersensitivities, which are symptoms of BPD, which is a core characteristic of borderline personality disorder. So broader perspective, Fatal Attraction's accurate depiction, it is an accurate depiction because it understands the hardest details, the way it showed Alex Forrester facing her symptoms and how she ended up going around and displaying these to everyone was very good, and she's like normalizing them and helping people understand, because it was filmed during the 1980s, how it's actually like and how someone suffers with it. So the film influenced our understanding. So it helps make this sort of clear and helps us visualize, because we're able to see all these symptoms and what's happening to her, helps us relate to the characters, and it sees the reasons behind why they do something, how they're feeling, and why BPD happens, or their symptoms and why they're doing it. And here are my citations. Thank you.